Hi, ladies. I hope you're doing well. We're going to do our Chapter 7 lecture video for our Module 156. Some of y'all are 156, some of y'all are 157, and I have some in 152. So I have all these numbers in my head. But anyway, so this is going to be our last chapter of this book, and then we'll be moving into Module 157, which is your SIMS charting. So that'll be fun and exciting for you guys. And we'll talk more about that when it comes time. So I'm going to go ahead and share my screen. I have to wait for it to move out of the way. There we are. So we're going to talk about the personal health record and patient portals. So if you see in the left-hand side right up there, I have a little picture of when you have a patient portal, what it would look like and how you would sign in. And I think all of us are kind of adjusted to the way that things are done nowadays. Us older people would call them the newfangled ways. So these are our learning objectives. Okay, so we're going to talk about what is a personal health record. It's a comprehensive electronic or paper-based record of health information controlled by the individual through which he or she can access, manage, and share confidential health information. It's a means of keeping health information current, safe, and in a single location. So, personal health record. It improves continuity of care, and it helps the patient save time and money by keeping various specialists from ordering duplicate tests and procedures. Keeping a PHR, which is a personal health record, may allow patients to get a bird's eye view of their health care, perhaps spotting important trends or making connections between one symptom or condition and another. Just simply gives them a different view of their health care. The personal health record versus the medical record. Both are means of keeping health information up to date. Both offer some protection against loss of or damage the records that are stored elsewhere. And both aggregate data from doctors, hospitals, and allied health professionals into a single record. So let me ask you a question. What is the difference between the two types of records, PHR and EHR? The primary difference between a PHR and an EHR, or a paper medical chart, is who controls the data. Also, the patient can specify that information from the PHR be disclosed only in emergency situations. So we know that the EHR, the facilities are able to use that. Doctors, hospitals, things like that. So also something else I want to tell you about a PHR, it is not subject to HIPAA privacy protection, nor does it necessarily constitute a legal document. So that we know an EHR is protected by HIPAA and can be used as a legal document. What information is stored in a personal health record? Patient's demographics, past medical, family and social history, ICE, which is in case of emergency contact information, allergies, current medications, previous hospitalizations, and doctor visits. Patients sometimes store insurance information and claims payment history to keep a record of claims paid or denied. Types of personal health records: paper-based personal health record, personal health record software, and online personal health record. Cost, portability, privacy, and other factors should be considered in making the decision of which you would like to use. Paper-based personal health record. Patients who frequent a medical office or have a series of testing on a regular basis might find this particular thing overwhelming. But this method is inexpensive, easy to maintain, and secure. It's organized into a 3-ring binder so the documents can easily be added or removed. Tab dividers can be used to organize and identify documents, and it can be difficult to share the information that you have in your binder. But this is one of the ways that you could organize your paper-based PHR. Personal health record software. So you see our little thumb drives here. Health information is in electronic form, not online. It's a standalone software product. It allows the individual to create and save health information to a desktop or laptop computer, and files can also be made portable by saving them to a USB drive. The files are not fully functional when the software is not available. And then we have our online personal health record. There are dozens of choices available out there for online personal health records. It's accessible from any computer in the world that has an internet connection. Many websites have a free PHR system. Sites with advanced services and security charge a subscription fee, and it gives the patient easy access to a database of health information. Innovative features of a personal health record. Synchronization with medical devices, ICE notifications, which is in case of emergencies, drug alerts, limited interoperability, direct-to-consumer laboratory services, telephone consults, and satellite and MP3 technology. PHR systems are capable of doing a great deal more than just storing personal health data and linking to medical and drug information. However, many of these features are fee-based add-ons that require a monthly or annual subscription. For some patients, especially those with chronic conditions and their caregivers, this may be money wisely spent. Benefits to individuals, patients, and caregivers. The individual maintains control of the PHR if he or she is competent to do so. That means he or she must give permission to any family member who wants to access the information. PHRs offer the opportunity to do the following: take an active role in a loved one's health care, plan and coordinate care, learn about diseases and conditions, build friendships with and derive support from others who have the same condition, and avoid duplicate tests and procedures. Here are some benefits to providers. PHR improve patients' compliance with instructions and medication regimens, improve patients' recall of health-related events, give clinicians an alternative means of communicating with patients if secure email can be exchanged through the PHR. Practitioners who view patients as partners in making health decisions will appreciate the advantages that the PHR provides. Steps in creating the personal health record. Creating the personal health record can seem like an overwhelming job, but patients should keep in mind that information does not need to be collected all at one time. You need to decide which type of information to store in the PHR and explore the methods of storing it. Request copies of medical records from doctors' offices by signing records release form, and be prepared to pay a fee for them. Begin collecting and organizing the health information. Maintaining the personal health record. Maintenance of the personal health record must be a priority. Each time the patient is seen by a healthcare provider, the patient may need to sign a specific authorization for the medical office to release his or her records. Information entered should always be accompanied by a date. Many PHRs provide templates in which such information can be logged and easily retrieved. So let's talk about patient portals. Sometimes referred to as tethered PHR. provider-controlled gateways to an EHR and other services at the healthcare facility. Within the patient portal, the patient-controlled health record is the part of that site that contains data loaded by the patient. He or she alone can grant or deny access. It allows patients to go to a single site for health information and services. Now, you guys know that a lot of times when you go to a medical office now, they'll say, oh, do you have a patient portal? And that's what they're asking about. They're wanting you to get on to get your lab results or whatever, you know, if you have any questions or anything like that. It really makes it easier because then it really makes the fact that they don't have so many phone calls coming through the office, and it's just it's like exchanging text messages or emails. It's an easy way. It's a more modern way to do things now. Okay, well, I hope you guys learned something. I hope that you have a great afternoon, and let's see, this is going to be loaded for Wednesday. And you are actually going to be finishing up your Chapter 7 on Thursday. I don't see a reason why we need a live Zoom call this week, but if you guys decide that you want to, because I don't mind at all, I would love to get on and see your faces, but just kind of shoot me a message, a text message saying, no need for a Zoom call, or yes, I would like a Zoom call, or will you give me a personal call? So I'm going to leave that up to y'all, but please reply to me that says, no, I'm okay. Yes, I would like a Zoom call, or I need a call from you, Miss Marsha, or whatever you may need. I do want to say that when you come back to school on Monday, we will be starting Module 156, SIMS Charting. So you're going to need to get ready for that book. And there you go. We're just moving right along, folks. Anyway, have a great afternoon. Let me know what you need from me. I'm here for you always. Have a great day. Bye-bye, guys.